Nigeria is experiencing resurgence in COVID-19 cases after successfully slowing outbreaks. Today on Sound Health, we will look at precautionary measures against a second wave of COVID-19 in Nigeria. I am Olasumbo Modupe. Welcome to the show.
The National Coordinator, Presidential Task Force on COVID-19, Dr. Sani Aliyu, says there is no provision for COVID-19 vaccine for 160 million Nigerians as the federal government prepares to roll out a jab for citizens and other residents across the country to combat the deadly virus in 2021. Aliyu, however, said the vaccine will be free when the administration begins in the new year, but with the provision that Nigerians and other residents will pay for operations and other logistics associated with it. According to him, Nigeria's population is around 200 million people. Hence, only 20% of the number, 40 million, will get the vaccine in 2021, and another 20 to 40% in the next 2 years. The federal government has issued fresh protocols for airlines and passengers coming into Nigeria from the United Kingdom and South Africa. The Director General of the Nigerian Civil Aviation Authority, Captain Musa Nuhu, says this is a part of efforts to contain a fast-spreading new strain of COVID-19 recorded in both countries. The Aviation Authority said non-Nigerian passengers who fail to comply with the new protocol will be returned to the UK and South Africa upon arrival in the country. NU directed all indigenous and foreign airlines operating flights between Nigeria and the two countries to ensure all passengers comply with the fresh directive. Governor of Lagos State, Babajide Sanwo-Olu, has tested negative to COVID-19 and is now out of isolation. Sharing his experience, Governor Sanwo-Olu says measures such as the 12 to 4 a.m. curfew by the federal government, as well as guidelines set by the federal government and the state government through the Lagos Safety Commission, will check rising cases, hence no vigils or crossovers in the state. They also added that the state cannot afford another total lockdown, so long prescribed protocols and the required lifestyle adjustments, testings are observed that will help us enter 2021 stronger, healthier, and safer. The Lagos State government has sealed more event centers and fun spots for flouting COVID-19 regulations. During the enforcement of operations led by the Director General, Lagos State Safety Commission, Lanre Mojola, he said the closure came days after the new COVID-19 protocols announced by the state governor. Lagos State Safety Commission has been carrying out routine enforcement and monitoring activities throughout the holiday season to monitor the compliance with the government's directive on COVID-19 pandemic. The Commission added that legal action against the affected businesses for flouting COVID-19 regulations will soon commence. Over 83,000 cases and more than 1,200 deaths have been confirmed in Nigeria. Globally, there have been over 79 million confirmed cases of COVID-19, including about 1.7 deaths reported by WHO.
It's still Sound Health on Lagos Television. Joining me now via Skype is a public health physician, Dr. Samuel Okerinde. He's going to share with us precautions against the second wave of COVID-19 in Nigeria. Welcome to the show, Dr. Okerinde.
Yeah, thank you for having me.
Okay, suddenly there has been an increase in the number of cases. How did we get here?
Okay, I think we are experiencing this increase in the number of cases because we suddenly let down our guard when the government actually let down the precautionary measures, when they said, oh, we can go on with our normal life, with our social activities. Then you see a lot of parties, you see that the churches have resumed, the mosques have resumed, then people all of a sudden stop following the earlier or previous precautionary measures that were in place. So that is what is accounting for the increase in number of cases. It's simply irresponsibility on the part of, I would say, the populace, basically.
In other climes, Germany, India, and a few other countries, they are experiencing a third wave. Is there a second wave in Nigeria?
Okay, so a lot of there are different school of thought. Some people believe that Nigeria at the point was not testing much, so you really can't, because before you talk about second wave, you have to draw the curve. However, I would say confidently that Nigeria currently is going through second wave because the number of cases at the point plateaued. We're going down, or maybe we're not testing, as some people would argue, but we can see that it went down. But currently, based on the number of cases that we are seeing, a lot of professionals have argued that we are currently in second wave, particularly data has been released by the NCDC. Yeah.
Okay.
So we can say yes, we are currently in second wave.
Okay, Dr. Okerinde, what qualifies a second wave and what should we expect?
Okay, so we are for second wave, of course, we are expecting, if we don't have epidemic curve, we are expecting something to go up, to the number to go really very high, all right, and then come down, then plateau at the point. Now, when you begin to see increase in that number again, all right, just like wave, when we are doing wave, okay, the increase in number, at least the numbers of cases, of confirmed cases being seen, is going up higher than what has been seen in the previous weeks or months. Then we can say we are going high, and that has been seen. I think yesterday we had about 900 something cases. That shows that the number compared to what we were having before is already on the rise. And like I earlier said, there are so many things responsible for that. If you go around Lagos, for example, you see that there is one social event. A lot of people are all of a sudden getting married. They're using malls for events. Churches are already open, camps are already open, millions of people gathering together. So that is what is responsible for the current increase, which accounts for the second wave.
Okay, so what should be responsible for a second wave, and could it be attributed to a disregard to the non-pharmaceutical measures or precautionary measures set earlier?
Oh, of course. Like the only way we can be most effective, of course, way for controlling COVID-19 is non-pharmacological measures. What are they? Your regular hand washing, with soap and water. If there is no soap and water, you want to use hand sanitizer. Wearing of your face masks regularly. You want to talk about avoiding large gathering when you have a lot of people. Wearing your face mask. If you go around the street, if you go to all those parties, there is no social distance. There is no social distance. There is no hand washing or bathing there. So those things, lack of the adherence to the non-pharmacological preventions or measures are the ones that are really responsible for the surge in cases that we are seeing right now.
Earlier in your response, you pointed out that we've not been testing enough. What should be done regarding this? How can key players boost testing now?
Okay, so testing, I must say, is very, very compulsory. It's very, very important. It's one of those ways in which you're able to track and monitor how people really are infected. At a point, there was I would say that there was this losing of guards. At the point we didn't see it as important because, of course, a lot of people got fatigued. I must say that a lot of people have lost income and they were really tired. So the fatigue was across the board, the government, the people. Okay, so testing is very, very critical. What must the government do? The government, of course, needs to ramp up testing. They really, really need to test more. The more people you test, the more you are able to pick up. And if you did not test, you can't record cases. And I can tell you that a lot of people who seemingly have been complaining of sore throats, dry cough, but they have not gone for testing. Those are what we call missed cases. Okay? And the bad thing about that is if those people, of course, because they are mild cases, they could recover, but they will go on to infect other people. Okay? and that is how the infection will continually spread. And the problem with that is that we may now not be able to eradicate COVID-19. Like earlier said, that is what we currently have in countries like Germany, like India, because a lot of asymptomatic patients, of course, are transferring or transmitting the virus. So I would just want to encourage everyone to, as much as possible, be responsible, carry out the precautionary measures. Wear your face masks everywhere you are going. You can see with mine everywhere I go to. Recently, we lost a medical professional, a medical doctor to COVID-19. And a lot of people also, this week alone, I've had cases of at least 4 people that are close to me that have died to COVID-19. So yes, COVID-19 is still out there, it's real, and we need to be responsible by taking the precautionary measures to prevent this spread.
Okay, Dr. Okerinde, from the look of things now, is another lockdown possible in the country?
I would say that going on another lockdown now may look like an impossible task, because I'm sure we've had enough in 2020. I mean, it's been a very, very challenging and tough year. To want to start 2021 on the lockdown, I personally do not subscribe to it. I think instead of lockdown, it's just for us to be responsible. If we all put on our face masks, wash our hands, ensure there is social distancing, ensure we don't go to enclosed places, I'm sure we'll probably do better rather than going for lockdown. But if we don't do that, and we continue in our current, pardon me to use the word, irresponsible way, then when the number gets to a point, we may have no option than to lock down at that instance. But I'm happy because the vaccine, of course, is being rolled out. Some are saying that the government is saying that hopefully from February or maybe the first quarter, we'll be getting the vaccine. So the vaccine, of course, may be an important strategy that may help us prevent even the spread of this COVID-19. But how feasible that is in Nigeria or how quick it will happen is what we cannot ascertain.
Okay, before I let you go, Dr. Okerinde, while we await the vaccines, the arrival of the vaccines, what can be done to beat COVID-19?
What can be done? It's
Yes.
the same message that we have been preaching over and over again. One, we need to start from the government. The government needs to increase their awareness on COVID-19. Just recently, Governor Sanwo-Olu, the case incident manager in Lagos, did also caught COVID-19. That is to let you know that COVID-19 does not discriminate. Whether young, old, poor, rich, whoever you are, you can catch it. So the government needs to, one, increase their awareness. They need to, the national registration agency also need to step up. Number two, the government also needs to ramp up testing. They need to invest more in testing. The more testing we have, the more we are able to pick up cases, particularly the asymptomatic cases. Number three, the people themselves also need to be responsible. The government is not going to do everything for you. The non-pharmaceutical method we talk about. Ensure you wash your hands, particularly in schools, in market. Make sure people at every point in time are washing their hands. Use your face mask. If there is no water and soap, then you can use your hand sanitizer. Make sure you use your face mask everywhere. Avoid crowded places, okay? I want to appeal to the churches. I know that Christmas is coming, festivity period, but a lot of those churches are going to be filled up to the brim. Please, let's make sure that we have social distancing or physical distancing measures in place, so that people don't end up going to churches or mosques or markets and coming down with COVID-19. Okay. Those are some of the measures I think we can take to prevent the spread of COVID-19.
Okay, thank you so much, Dr. Okerinde, for your time.
Thank you for having me.
All right, I have been talking to Dr. Samuel Okerinde, a public health physician, on precautionary measures against the second wave of COVID-19 in Nigeria. Sound Health continues with trending health reports. Please stay tuned. Strict adherence to precautionary measures such as hand washing, use of masks, social and physical distancing will reduce the risk of contracting COVID-19. Please stay safe. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, please send SMS to 0035 826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.